So tell me why you're here. What is the issue that you're dealing with at the moment?
The key issue that I'm dealing with is the importance of non-communicable diseases. What we know from a number of studies is that even when the health system functions well, the quality of care to patients with diabetes, with heart disease, with lung disease is much lower, much less, and the medicines are much less available. And so these are conditions that can be very effectively treated. People can live long, productive lives, and at the moment it's not happening.
But I mean, everyone knows that, cancer medicines and all these things are really expensive even in Europe. So how on earth is anyone going to be able to afford it?
It all depends which medicines we're talking about. We're talking cents a month for heart disease, for diabetes, type 2 diabetes. Even for breast cancer, tamoxifen is $2.50 a month, which is often affordable for women who respond to it. The other breast cancer medicines that Novartis has included in their package, those will be made available at a price of about $1.50 a month. So it is possible. Now the cytotoxics, the heavy duty anti-cancer medicines, they need a lot more sophisticated care. But what we're seeing, even in a country like Tanzania, we're seeing very successful pediatric oncology being provided through relatively low-tech services. So the world is changing. We can treat some cancers very effectively. It's not that all cancers are curable. They're not. We know they're not. But some cancers are much more curable than others. A cancer that's quite common in low and middle income countries, choriocarcinoma, which is a cancer that a woman can have when she's pregnant and she has a blighted ovum. That is $75 for a curative treatment. Not for all, a 65-70% cure rate. And it's tragic if a new mother or a mother who has a choriocarcinoma can't be treated. So we need to find mechanisms to reach out, to look at these ways. Look back in time. When AIDS was first around, everybody said you can't treat AIDS in Africa. And the combination of the Medicine Sans Frontières pilot projects, the Partners in Health projects in Haiti, clearly demonstrated that you could. And now we have millions of patients being treated for AIDS. And HIV treatment is much more complex than diabetes or heart disease or respiratory disease. If we can treat AIDS in a country, we definitely should be treating diabetes.
But one of the reasons why the prices came down was obviously because of the competition from generic medicines. So, I mean, $75 for a Westerner is not so much, but when you're earning $350 a month, it's actually a lot.
It's a one-off treatment for cure. Also, we're not talking about patent-protected medicines in general. The vast majority of the highly effective chronic disease medicines for heart disease, for diabetes, for lung disease have been off patent for many years. Metformin is the leading oral hypoglycemic, the oral medicine used for treating diabetes. That's a medicine made by Merck, the German Merck. That medicine is still a dominant provider of care. It came off patent more than 40 years ago, 35 years ago. So we have some effective medicines. And we did a study which was published in the bulletin of WHO demonstrating dramatic differences in availability of acute medicines and chronic medicines. And this is not due to a failure in the supply chain. It's not due to the poverty of the system. It's due to a lack of priority for NCD medicines and treatment.
But I mean, if you're a Ministry of Health, say in Botswana or Kenya or, a country, say, with less of a budget, they have to prioritize. And I mean, why should they prioritize NCDs over, say, malnutrition and childcare?
No, those are clearly important, and I would not say they should prioritize over it. But what I'm suggesting is that if you can treat a patient for $1 a month or $2 a month, and many of these medicines are not provided by the Ministry of Health. They create an enabling environment. The mission organizations in many of these countries, 40%, 30, 40, 50% of rural health services are provided by the faith-based organizations. patients pay for those medicines. But if they're only going to pay $1 or $2 as against the $10 or $15 for the same medicines, remember most of the cost of these off-patent medicines are as a result of markups, distribution costs, and government taxes and tariffs.
Okay, thank you. Sorry, let me